Hi guys, this is Dr. Renata Harris from Reflection Center in Martinsville, and today I'm going to go a little bit more in depth about the before and after that I posted last week about some people call it frown lines, some people call it the marionette lines. Basically, it's the lines that go from the corner of the mouth to the jawline, and they're usually caused by two things. The main reason they're caused in most people is actually laxity. It's when the cheeks kind of start sagging and it comes forward. That's what's causing the fold. And then the other reason is when people start losing volume on the sides of their chin. That takes away some of the support that the area next to that has, and so that makes it easier for this to sag and come forward. So there's different ways you can treat it. The laxity is actually pretty difficult to fix non-surgically, non-invasively. We tend to do stuff for it like soft wave with Ulthera and Radiesse, which all happens on the side of the face, trying to get this to kind of pull up in this area. You can also do threads for that area, but it's all a subtle improvement. It's easier to fix if you have volume loss. The patient that we showed the before and after, her main issue is volume loss. She did have a little bit of laxity too, which is why it's not 100% corrected, but she had more volume loss than laxity. And if that's the case, then you can treat it with filler. We placed filler on the sides of our chin, but we also put some in the chin itself to kind of make the chin a little bit more pointy, and that also makes this whole area look a little bit more youthful. And then you create a little volume coming forward. On top of that, we also treated the skin because the skin was starting to have very fine lines and textural changes. So we did some micro Botox, diluted Botox. We make it much less concentrated than normal Botox that we use for the muscles because we place this in the skin and we don't want it to affect the muscles. And then we put it in little droplets all around this area, trying to help smooth out the skin. We still also do regular Botox in that area, and we do it in her chin because there's a muscle there that tends to start rolling up the chin. So she does that in addition to the micro Botox, and then we also do Botox on the side of the mouth in that muscle that pulls down the corner of the mouth. All these three treatments has improved the appearance of the lower face, as you can see in the after photo. If you want to find out what's causing your frown lines and want to know what treatments options are available for you, please feel free to schedule a consultation at our office.